So as a whole, looking at these numbers for hypertension medications, you always want to know what the client's normal blood pressure is. What to expect from them. Because like I can take a patient's blood pressure and their blood pressure is like 160 and they're like, "Oh, that's great." And I'm like, I don't think so. But oh yeah, sorry, by the way, let me introduce. This is a part of my long lecture over hypertension. This is the end. We just finished all the meds. We're getting into nursing actions and things like that when it comes to hypertension. So after looking at all these meds, like I said, we want to always know what a patient's normal blood pressure is, because whatever their normal is, or like, especially when I was new, like I even thought 140 was scary. I was like, oh my God, they're hypertensive. And yeah, 140 is actually pretty good for some people, but I always want to know what's normal for them or how far we are from their normal. Remember, we give medications even if their blood pressure is normal, like oh, excuse my burps, one teens over 60s. That's good. But we do usually the holding parameters are around like a systolic less than 100 or heart rate less than 60. Always check your orders. But on the exam, if no parameters are given, this is what you're expected to go by. Know your potassium normal. And see, this is a great way to study from this slide is thinking about, okay, which meds would I need to hold if the systolic blood pressure is low? Well, that's going to be all of them. Which meds would I need to hold if the heart rate's less than 60? Beta blockers, calcium channel blockers. Now we're going to look at, you need to know your potassium normal. Then go back and think, which meds are related to potassium? Potassium sparing diuretics, potassium wasting diuretics like loop and thiazides, ACE inhibitors and ARBs are also related to potassium. You need to know your kidney function. Then you could go back and think, which of the meds were related to kidney function? Diuretics and ACEs and ARBs. And then as a whole, as you're, giving medicines as the nurse, you want to know the client's history and, other things that could be affected by medication. So if they're diabetic, what's their blood glucose? Because I'd worry about it being low. Or, if they had hypoglycemia, it might be masked. Which medication was that? Beta blockers. So all beta blockers can hide that blood sugar drop. And then restrictive airway disease, that's just the non-cardioselective beta blockers. I'm going to monitor for that bronchospasm. So now I know you're so happy to talk about something other than meds. Let's talk about diet. I know y'all hate diet questions, but you're going to need to know your diet. As we go on, there's more diet stuff that gets scattered in. Effectively, the DASH diet. And this diet, again, is healthy for, people with any cardiovascular disease as a whole, because it's just a generally healthy diet. Whole grains, vegetables, fruits, more fat-free or low-fat choices, so legumes, some like lean meats, like white meats, poultry and fish, and then healthy fats and oils is pretty much where it's focused. Exercise wise, and remember I've talked about, don't get too much in the weeds. Like there might be different stuff written here than what was written in some of the other exercise stuff, but we're not going to give you some crazy thing when we're like, oh, we said flexibility for 30 minutes over here and 45 for this one. No, we're just, they need to move. They need to get moving. The benefits for blood pressure is that it can lower the blood pressure itself. It promotes relaxation, decreases stress. That cortisol and sympathetic nervous system that's always activated might calm down, which is why I always recommend you guys get a little exercise before your exam, like go and walk a flight of stairs, walk and get moving. It helps. It makes a big difference. I literally, like, no joke, like the gym is my escape place. And so like when I go there, I don't even care about losing weight, getting pretty, anything like that. I just want to have good mental health. And when I go in there with that, like, it doesn't matter what I do. It's amazing how I can feel afterward. It's just like a time to, no matter what's going on before I get there, when I leave, there's always a different feeling. And it's all those beautiful endorphins that get released. Exercise helps to decrease or lower or control weight and then stress as well, like I mentioned. We usually like people to do like moderate intensity exercise. That would be like if someone's on a treadmill that when they're walking, they can't comfortably talk at the same time. Muscle strengthening, flexibility, all that stuff's good. But, the big picture here is we want them to start low and work their way up gradually, not just start running if they've never walked a day in their life. And then we want them to do things that they actually enjoy. They're going to be more likely to keep up with it if it's something they enjoy. So, as a whole, I'm going to encourage lifestyle changes, weight reduction, the DASH diet, limit sodium intake. And you're going to see different stuff in your book about sodium intake. It's kind of confusing, but if you look at it, it says like a normal person should have like don't know, say it's like 2.3 or 2.5 or less. But then if it's someone who is, um, what do you call them? If it's like it doesn't really clearly say what you have to stay below if you have hypertension. But this is what I'll say is generally when they're in the hospital, they're either on a 2 gram or there is 1.5 gram sodium diets, but usually you're going to see them on a 2 gram sodium diet. So we usually like it less than 2 grams. We're not going to give you anything too tricky on the exam, but we want something that's on that lower end, less than that 2.3, because that's what's good for a healthy person. But if I'm not a healthy person, I have hypertension, I want to, do even better than that. Decreasing alcohol intake and other things, because, 1 glass of wine could be healthy, but other stuff definitely can be detrimental. Increasing the physical activity, getting moving, like we talked about, and avoiding tobacco products because it causes that vasoconstriction is horrible to my blood vessels. And then also making sure that they know resources to decrease stress and manage psychosocial factors that affect blood pressure, like don't go to nursing school, things like that. But if they need medications to help with depression, anxiety, change of career, lifestyle, when it comes to whatever situations they're in, support groups, 12-step groups, they may need extra help. All right, so this is a video I usually show about medication compliance. And the key here is just that kind of the point that I brought up earlier is that people struggle to stay compliant with medications because there's a lot of them. They have similar names. It's hard to keep them all straight. They have no symptoms, but yet then they're taking a medication that's going to cause side effects that's going to make them not even want to take this medication. So it can be really difficult. But compliance is a real issue. And just as the nurse, I want to see what their barriers are and help them. So whether it's that I need to, I can provide education and say, hey, this is really serious, can lead to really serious things. But, sometimes it's just the practicality of how can we, find a way to make this more manageable for this patient so they're going to stick with their medicines. This is great. Let's do an application check. So a client with hypertension is being discharged on metoprolol oral tablets. Oh my goodness, too many recordings today. Tablets. Mark each statement as representing whether the teaching was effective or ineffective. Ooh, and it's like a drag and drop. You kind of like, ooh. All right, so let's see. Let's go down. True or false, ineffective or effective. So they're on metoprolol. So I could either ask a teaching question about hypertension in general or metoprolol. Let's look. I will check my heart rate prior to taking this medicine. I think that is true. It's an LOL. It's a beta blocker. This is how we remember beta blockers. Lots of laughs, lots of lows. So we want to check your heart rate because it can lower your heart rate. And we're going to hold it if it's less than 60. All right, the next one. If my blood pressure is low, I will take half a dose. Don't think so. What do you call it? I'm not going to want to change my dose at all because I am, as a patient, I'm not going to tell as a nurse, but definitely as a patient, I don't want them to be playing doctor and, increasing doses, decreasing doses, having doses, holding their doses, that kind of stuff. So I'm going to say no. If their blood pressure is low, maybe they need to call their doctor, talk to their doctor about that. If I'm feeling lightheaded or dizzy, I will hold the medication. Well, there's some education needs to happen here because we have to think, is it expected for them to feel lightheaded and dizzy? One, probably check their blood pressure. Two, I want to tell them maybe do they just change positions? They need to change positions slowly. And that, what do you call it? It is an expected side effect and we can tell them. And again, when someone has an expected side effect, I'm not just like, too bad, it's what it is. But I'm going to tell them how to adjust. And so the best thing you can tell someone who's lightheaded or dizzy is change positions slowly. If I'm going to be exercising or exerting myself, I can double my dose. Absolutely not. You should not be doing anything changing your dose. So this is another good teaching in general with all, it's not just about metoprolol, all hypertension meds. They don't double doses. We don't have doses. I need to lie down while taking this medicine to reduce side effects. That's actually not needed. I know most people are probably going to think, oh yeah, that's true. I should lie down. They don't need to lie down. What do you call it? They can sit up while taking that medication. It's not like nitroglycerin where you need to sit down because it's about to give you like the kung pao, and knock you out or knock you down or, vasodilate you. So this one, they don't need to lie down while taking it. If anything, if they lie down while taking it, then they start changing positions, that might be worse. But it's unnecessary. I should check my blood pressure at the same time every day. Absolutely. So we want to get a good reading of their blood pressure and know what their baseline is. So definitely they should take it at the same time to get the most accurate log. I should hold this medication if my systolic blood pressure is less than 130. Well, it's going to depend on what their doctor orders, but based on the parameters that I have given you, that we kind of go for this exam, they shouldn't hold it. They should definitely take it unless their doctor has otherwise said so. So usually remember we only hold if their systolic blood pressure is less than 100. I will need to increase my fluid intake while on this medication. So we talked about this a little bit earlier. So with someone with hypertension, they don't need to be on a fluid restriction, but fluid is not going to help them. They're not dehydrated. That's not why their blood pressure is high. They got a vessel issue, a plaque issue, other stuff going on. It's really rigid, hard arteries. So, what do you call it? When it comes to this, we there's nothing about taking metoprolol that requires them to drink more fluids. So the answer is going to be that's ineffective because it actually can make things worse because it could increase their blood pressure because fluid is volume, volume is pressure. So the more volume I have in my body, the more blood pressure I'll have. And I'm trying to avoid that. So it'd be kind of counteracting what I'm trying to do with the metoprolol. I need to improve my diet and get regular exercise with this medication. Absolutely. It would be very ineffective if this patient said, all I have to do is take this medication. I don't need to exercise or I don't need to change my diet. Same goes for cholesterol medications. If a patient's like, oh yeah, I don't need to, do anything when it comes to, my diet or exercise, they need to change their diet and they need to exercise for sure. All right, so this is the AHA Simple 7 just to keep a generally healthy heart. Beautiful picture, by the way, right? Just makes you want to, get out there and learn about cardiac all night long. Manage blood pressure, control cholesterol, manage your glucose, get active, eat better, losing weight, and stopping smoking. So these are like if you were trying to like go through all together everything you want to do for all the cardiac disorders we've learned so far, this is it. This is a lot. This is pretty much all we want to do is manage all of these things in order for a better lifestyle. So some lasting education, keeping in mind that there's no cure for hypertension. We can manage it. We can make it better, but that medication compliance is going to be key. We want to teach them what their blood pressure should be. And again, everyone might have different limits. So we'd want to check in with the physician what they want their blood pressure to be. And we want to tell them when they should be worried. Like when is their blood pressure? Like what are their parameters when they need to start calling, whether it's too low or too high? And knowing that everyone has different goals. We're going to teach them about home blood pressure monitoring. Remember all the things I taught in the earlier video about how to take your blood pressure at home and the things to watch out for. We're going to track their blood pressure through applications, journals, things like that can definitely help because that can help to watch for trends, especially if they're eventually some medications effects can start wearing off, and that's why they end up adding more medications. So we want to kind of watch the trends. If they're kind of trending slowly up, it might be time to add another medication. So the doctor will want to monitor that. And then, like I just brought up, you take your blood pressure, your medicine, even if your blood pressure is okay. Don't stop taking it suddenly. Don't double up or change your dose, half it. You'd be surprised what happens often is that, especially like married couples that both take similar medications, they'll take each other's medications or like, oh, well, she takes a double dose I'll just have it. Like, no, they should not be taking their friends, other people's medications. This actually happened. This is not about hypertension, but there was a lady who came in who overdosed and she said like she was really anxious and messed up and her drug dealer gave her some pills that she said would help with anxiety. He gave her a beta blocker. And so she ended up in the ICU with, pretty much shock because of the beta blocker and a very low heart rate, like in the 30s. So don't trust your drug dealer. They're going to give you a beta blocker. It is not going to have the same effect on your anxiety. It ain't getting you nowhere high. But you never want to take pills from someone else's cabinet is the lesson, moral of the story. All right, so let's do some little practice here. I have a worksheet on my Google Drive that has some more of these, but it's really good to practice these in scenarios. So for each of these medications, let's look at a time when we would want to hold this medication. So first we have atorvastatin 40 milligrams. So this brings us back to cholesterol meds. So atorvastatin is a statin. When would I need to hold this medication? Well, if the patient, I would have to check if their liver enzymes maybe were super elevated, or if they were experiencing muscle pain, I'd probably want to check in with the doctor first because they might want to test and make sure that they're not going into that muscle breakdown, that rhabdomyolysis. That might be a time that I need to hold it. Somewhere that you might get tripped up is you might see like, okay, we give you some labs and the cholesterol level is high, and you're like, "Ooh, hold it." Well, why are we giving this med? We're giving it because their cholesterol is high. If their cholesterol is high, I need to give it. And same thing, if their cholesterol is normal, great, we need to keep giving it because maybe that's why their cholesterol is normal. The captopril, 12.5 milligrams. So it's a pril, so it's an ACE inhibitor. So we want to go back to, okay, what to remember about ACE inhibitors? So with ACE inhibitors, we want to be concerned about their kidney function and their potassium. And then also the possibility of having a angioedema reaction and the cough. So those are the 4 things for ACE inhibitors. Now, which would make me have to hold it? Let's look through it. If they had a cough, I don't necessarily have to hold it, but I definitely want to report that and make sure the physician knows, because again, if it's nagging and they're going to stop taking the medicine, maybe we need to switch to an ARB, or it could be, it could be a sign of the angioedema. So I might want to report it, but it's not necessarily not safe to give. And we're not going to give you some tricky one like about the airway thing where we're going to be like, ooh, you have to realize that their airway could be closing. Hold it. The main things I really like, I don't want you to get too caught up on the angioedema thing because it's very rare. But what I do want you to think about when it comes to ACE inhibitors is about the potassium, is about the kidney function. That's a lot of what it is. Generally, yes, I do want them to report the cough and stuff like that, but as a whole, the big things I'm worried about is the potassium. So I would have to hold this. If my potassium was super high, I would need to contact the physician, or if my kidney function was super high too, like where they were had very poor kidney function. There's also spironolactone. This is a potassium sparing diuretic, so I would need to hold this again, just like the last one, if their potassium was super high. But also, I'd want to look at kidney function. So think diuretics and ACE inhibitors, both of them, kidney function and potassium. I'm going to be worried about those. Also, so far for the captopril and the spironolactone, if their blood pressure was super low, if their systolic was less than 100, I would need to hold it as well. Sometimes it comes to me later. So, clonidine 0.1. So what would I have to hold this? So the only thing that would require me to hold this is if their blood pressure was low, like their systolic was less than 100. But otherwise, it should be safe to give. There's not any other interactions or contraindications. Then last but not least, aspirins. This is bringing me back to my aspirin days teaching. It seems so long ago that I was talking about aspirin and after going through all these blood pressure meds, but aspirin, we would need to hold that if the patient was having signs of bleeding, if they were going to be having a surgical procedure, we still need to check in with the doctor, make sure that they want to hold it. What do you call it? I'm trying to think if there's anything else. Bleeding, maybe if there was a really like low blood pressure and we're thinking they're bleeding inside, something like that, low blood pressure, high heart rate, we need to investigate more. The main thing would be bleeding is a reason to hold it. And then if the doctor prescribed us to hold it because the patient has a procedure. All right, so here's some open-ended questions we can look at, and then we are done with hypertension. Woohoo! You're like halfway through cardiac. You've just got dysrhythmias, yay, and heart failure left. So, well, there's still cardiac and complex, though. Get ready. Anyway, what medications that can be given for hypertension may react or have adverse side effects when given together? So this is something I can't do this in one sitting, but you want to think about a lot of things. We haven't even talked about digoxin yet, but digoxin interacts with potassium. So any of the ones that interact with potassium, like ACE inhibitors, potassium sparing diuretics, stuff like that, or loop diuretics or potassium wasting diuretics, all those can interact with digoxin. We talked about thiazides, they can interact with NSAIDs as well. We talked about how any of the potassium sparing, we don't want to give with the ACEs. I don't want to give 2 vasodilators together. So erectile dysfunction and vasodilators can't go together. I didn't talk about this, but I would never want to give an ACE and an ARB together. They're both going to do the same thing and can lead to an unsafe increase in potassium. So there's sometimes some meds, like I'm never going to give 2 beta blockers together, things like that. I can give 2 different classes. I might have a patient who's on an alpha, a beta blocker, a calcium channel blocker, and a vasodilator, but I'm not going to usually give 2 of the same type of med, except diuretics. So that would be the only exception there. So that's just a few to give you some ideas, but it'd be great to write them out and think about each class or each type of med and which one has interactions. 5 priority teaching points for a client with hypertension. So I think medication compliance, how to check their blood pressure, when to call the doctor, like, like what are the signs that there's a problem or things are getting worse. Definitely the medication teaching too, specific, like that's going to be very important for their specific meds. Don't double up on doses, don't half your doses, don't take anyone else's med. The diet and exercise teaching, lifestyle changes, quit smoking. I could go on, but those are just a few. 5 things to teach a client about taking their blood pressure. Ooh, this is good. So we want to teach them they want their feet on the floor. What do you call it? We want their arm at heart level, right cuff size, right time to make sure that they're not stressed out, that they've rested before. We want to document where we take the blood pressure and kind of keep track of it. No talking, no crossing their legs. That's a lot of them. But yeah, I think that's a good amount of things, at least to get you started. We survived. I survived and you survived. We made it through this lecture, and there will be more to come soon. See you then.